Hello, I'm Hope Helfrich with Wesley Medical Center. I am the Student Placement Coordinator, and I am thrilled today to include our pharmacy companions and colleagues as we look at the role of the pharmacist within a hospital. I'm part of Wesley Medical Center and also part of the ACA Continental Division. So today I have with me some very esteemed pharmacists. Miles is over on the far side, Leela is in the middle, and then Heather is over close to me. And they are going to use the questions you've submitted and maybe some additional ones if we have time that you will be sending to your instructor, and they will talk about how they are a vital part of Wesley Medical Center and the care we provide all of our patients. Thank you guys for joining us.
Yeah, thank you for having us. Like she said, my name is Miles Carter. I'm one of the pharmacists here. I just started my residency this past year. I've worked here at Wesley for 5 years, first as a tech, then as a pharmacy intern during school, and now as a resident.
And I'm Leela Hernandez. I'm one of the pediatric pharmacists here at Wesley Children's. I went to KU for pharmacy school and have been practicing for 15 years now, 9 of those here at Wesley.
Hi, I'm Heather. I am a adult internal med clinical specialist here at Wesley. I also spend time working with our medication safety program. I graduated pharmacy school in 2013, and so have been at this for a little while now. So I know a lot of you guys had questions, particularly about our education. Like I said, I graduated in 2013, so I'm a little ways out at this point. Miles, being a resident, is just out of school, and he can answer some of those questions, have some good ideas in terms of what all classes are required, cost of tuition, and all of that for you.
Like Heather said, there was a lot of different questions about college and the education required to become a pharmacist. So how many years of college does it take to become a pharmacist? This was asked by a few people, but currently in Kansas, it's 6 years. So there's 2 years of pre-pharmacy, and then it's a 4-year program. In your pre-pharmacy, they have a set criteria. It has a lot of biology, some math up to Calc 1, which you could also do as business calc, which is a little bit easier version of calculus. But let's see. And there was also a question asked by Emmanuel about the cost of tuition. So about the cost of tuition. So at KU, which is where I went, and it's the only in-state school currently. For the 4 years, including 2 summer rotations, it's right under $100,000 for the whole 4-year program. So that would not include the pre-pharmacy education that you'd have to do prior. But there are plenty of scholarships and everything to apply for, so I would encourage that regardless of the program you go towards.
I know that several people asked, why did we decide to become pharmacists? What inspired us to become pharmacists? For me, I grew up with a family in the medical field. I got lucky in high school and happened to get a job at a local independent pharmacy where I grew up, and fell in love with the difference that I could make with the patients and educating them, helping them afford their medications, giving suggestions to physicians on what medications they should prescribe, and it was the perfect fit for me. I don't know what you guys feel was your biggest influence.
For me, it started pretty early when I was younger. I was a pretty healthy kid, but whenever I had to take medicines, I was kind of the smart aleck kid, asking my parents, well, how does this work? How is this going to help me? And so they always told me to ask my pharmacist, and then I really learned from an early age that the pharmacist is really the one that knows all about the medications, how they work, what side effects, and then from then on, my interest just grew and grew. So I took science classes, and then in college, kind of stuck with the pharmacy direction.
And for me, I had a pretty similar early interest. My mom worked in a pharmacy managing their front end, so I was there often seeing the pharmacists interact with their community. And I really enjoyed seeing how much he really meant to that community and being a resource for them. That was something I wanted to be able to do for my friends and family as well as just the community.
Yeah, and I think that one thing that a lot of people don't necessarily understand that is super important in terms of being a pharmacist is that the level of expertise in terms of medications and drugs. Most physicians have maybe a semester of pharmacology. We do 4 years of just looking at those medications, how they interact in the body, exactly what happens, and it's really great to be able to step up and say, hey, this medication is going to interact, this is exactly what's going to happen, and prevent problems before they start.
That kind of leads us to one of our next questions, is what's something that you really enjoy about your job? Like Heather said, we are the medication experts, so it's nice to be looked upon for that information, whether it be patients, physicians, nursing, any of our medical professional colleagues. So a lot of us work on the inpatient units in the hospital. So for me, I go around and see the patients with the doctors, and they ask me all the time, what should we do for this patient? And then after that, I'll go talk to families about their medicine. So that's one of the favorite parts of my job, is just teaching people medication information.
Absolutely, I would agree.
I would agree. I love being able to go into a patient's room and then being there for something, and they're able to ask me any question about their care and just kind of help them get a better understanding of what's going on.
In terms of the difference between a hospital pharmacist and a pharmacist that works in retail or another setting, one of the things to kind of think about is everyone thinks of a pharmacist as the person that takes medication from one bottle and puts it in another bottle, and we do so much more than that. In terms of working in a hospital, the three of us hardly ever actually touch a drug. What we do is typically much more rounding with physicians, education, projects to improve medication safety, filling out reports to report to the FDA for any drug problems and all of that stuff. So it's very comprehensive. Depending on what setting you typically would work in, some people may be in ED where they're responding to traumas, codes, sepsis alerts, all of those types of things. Some of us, obviously, you know, I'm in the adult side, Leela's in peds, and Miles is getting to see a little bit of everything right now.
And then I actually worked at a retail setting for 14 years throughout school, and then even after I was done graduating. They also have a huge role in just the community health. Not only are they filling your prescriptions, but they're also really accessible for your medication questions. So after hours, it's typically hard to get a hold of your physician if you have just general medication questions over-the-counter wise, or for your prescription medications. A pharmacist is pretty easy to get a hold of. Nowadays, pharmacists in the outpatient setting are doing a lot of medication education as well, but also immunizations. Currently, they're doing a lot of COVID testing. So they stay very busy and very involved in healthcare in the community.
Absolutely. Miles, if you want to talk about this, there's one of the questions on difference between a pharmacy tech and a pharmacist, and you've got to spend time working as a tech throughout school, so if you want to tell them a little bit about that.
Yeah, so there is a pretty big difference. So the pharmacist is the final check on everything, and typically the pharmacy tech will be the one getting everything prepared for final check, making medications in the IV hood, so that's generally making operations run. They'll deliver medications to the machines and different, to the nursing stations for patient-specific. Yeah, and they also help run our central pharmacy, directing phone calls, and making sure everything gets done. And then the pharmacists in the clinical setting, or at least in the central pharmacy, which is where all the medications come from, they're performing the final check. They're making sure that everything keeps moving and that we don't miss anything. And
I do think it's important to add that our pharmacy techs are really our unsung heroes of the group. We couldn't keep it going without them, for sure.
And currently, pharmacy tech doesn't require schooling, but they are kind of moving towards that. And to work as a pharmacy tech, most places require you to be licensed, but you'll have to get licensed within the first 6 months of working at a job as a pharmacy tech. So they do have a certification associated with their work. Okay. I believe we're going to go ahead and show the pharmacy video, just kind of give a brief walkthrough of what our pharmacy looks like, a little bit of what we do. So this is Katrina. She's one of our tech coordinators. She's getting ready to scrub in, as they say, to make some IVs. So this is the gown that they put on to help protect the product from us, essentially, to help make sure that what we're making stays sterile. Gloves. All right, and what she's pulling that out of, it's called a pass-through chamber. So it's something on the outside of that clean room, which is a closed room with special airflow. And that's how we get things from the outside into the room to be able to prepare it. So as you can see, she's wiping everything that goes in. That is one of our standards. We have to make sure to wipe everything with sterile alcohol prior to putting it into the hood. What she's using there is, they call it a compounding hood, but it makes sure, it ensures sterility in the chamber to be able to make the product. So these are some of our hazardous compounds. So these are made in a different room and held in a different room. So hazardous compounds have different regulations on how they need to be made and handled. So they do have a whole, they have their own guidelines separate from how to prepare regular sterile products. Okay. So this is our oral compounding. That's actually what you can, that's where we're standing currently. So that was where we would draw patient-specific doses. And those are a medication waste. This is for our Pyxis machine, which is a cabinet. It's kind of like a vending machine for medications. So these little, they call them cubies. They're little pockets that you put the medication in to load it into the machine. And
This is our carousel. It helps hold all of our medications. Things are put in there specifically to make sure that look-alike, sound-alike medications aren't next to each other, and just do everything as safe as possible when we're dispensing our medication.
It also keeps really good track of inventory, so once we start using things, it'll automatically send alerts to order new ones so we don't run out of medication. The fancy little robot.
Yeah. So at Wesley, we actually have 4 of these, and they hold a lot of medication each. So we have 1 for our IV compounding and 3 for our general medications. This is your area.
This is a pediatric pharmacy that just opened up very recently within the last couple years. So we like to separate our pediatric doses from the rest of the hospital. The pediatric doses obviously are smaller, they're more specific, so we try to keep them safe away from the adult medication.
Okay, and this is one of those Pyxis machines I was talking about. So that's one of the cubies that they would have made downstairs. And it's having her count the medication to ensure there's the right quantity and pulling whatever she needs. This is for medication waste, for controlled substances. That's to keep that waste contained, and it does require key entry that's only accessible in the pharmacy.
And that's me talking to a respiratory therapist. So as I mentioned before, the pharmacists are heavily relied upon by other medical professionals. So we were discussing a patient and their care.
Okay. All right. So at this time, we'll see, does anyone have any questions currently? Where would they?
Right there.
Okay.
Okay, can you hear me now?
Yes, and you can also put questions in the chat if that would work.
Okay.
Okay, and what's your question?
So at the end there, you were talking about discussing, there was a pharmacist talking with someone from respiratory care. Obviously, COVID's been, I don't know, have you guys heard of COVID? But it's affected you guys directly. Like, are there medications that are being used more with the patient with COVID? Is there like a demand for something in the hospital, like, oh, because of COVID, we're really running low on blank? Like, what has fill in the blank as far as in the pharmacy? What have you guys been kind of heavily impacted so far as with COVID?
That's an excellent question. There's a few medications that typically are used for other indications. For my population specifically, there's a medication we use for arthritis that our patients commonly come in every 2 weeks for their infusions. Well, now some of those medications can also be used for COVID. So we're trying to be very careful about making sure our pediatric patients get their infusions when they're scheduled, but also being allowed to take care of the COVID patients.
We've also had to deal with COVID coming around, we've had to deal with different ways of working with medications. Typically, a medication goes through its extensive study and it is FDA approved, and then it goes to the population. In the instance of COVID, there was enough data to say we had approval for what we call an EUA, which basically means there's enough data to say this might be beneficial. We need to let people try it and try to save lives. So we had to deal with some different government regulations and ways of getting medications in terms of one medication I'm sure you've all heard of, which is remdesivir. We've also dealt with, as patients are needing increased ventilation and being on a ventilator, that's very, very uncomfortable. So we frequently have to sedate those patients, sometimes paralyze those patients. And so we've definitely seen an upswing in some of those sedatives, paralytics, even the use of sterile water has become an issue as they need that water to help humidify air as they're using it on the vent. So it's caused definitely a chain of difficult situations that we've had to work around. Miles, I don't know if you have.
I don't. The only thing that I would add, as far as like more of a tech aspect for it, with COVID and everything changing so rapidly, we did have to have more frequent meetings to keep us updated on what we need to do to keep everyone safe. And additionally, with COVID, you have contact precautions, so that you only have certain people that can go in there after getting everything, all their protection equipment. So delivering medications at times that worked well for nursing, so they didn't have to go in multiple times, just kind of working that out was something the techs kind of had logistically changed.
Any other questions?
Why am I? Oh, there we go.
You're unmuted now.
Okay. So then what you were talking about there is almost from a logistics or like an efficiency point of view, just like now that there's so much going on, like, okay, how can we streamline these processes and stuff?
Mm-hmm.
We did also have certainly a clinical role in all of that. A lot of what we saw, particularly at the very beginning, was evidence coming from the coast, specifically New York. This is what we've seen, this is what's worked, this is what we recommend you do. Guidelines are changing constantly in terms of COVID-19, therapies that are being used. At Wesley, we have an ID specialist who helps stay on top of that, but it is definitely a group effort, staying on top of this evidence change, we need to change our practice, and then calling and educating physicians saying, for example, higher risk patients for blood clots, making sure they're on the correct dose of blood thinners and those types of things. So it's not just a distributive issue. There are multiple levels within COVID of work that has to be done.
If you guys have a question, let them know. So can you guys still hear me?
Yep.
Kind of a silly question, I guess, but so speaking of some of the medications, and it's just so nice when you can talk to an expert that actually knows what they're, like you guys said, you're talking with other hospitals and trying to get to what the, what the facts are and what the truth is and all that. What was I can't remember the name of the drug off the top of my head, but the anti-malarial drug that was kind of all abuzz when COVID first hit. What was the name of that one?
Hydroxychloroquine?
Yeah. Has there anything come out with that? Is that, I don't know, what are some of your thoughts on that? Does that help at all? Was that just kind of a no? Was it not worth the risk? I don't know. What are your guys' thoughts on all that?
Safety-wise, anything you put in your body is obviously going to have a side effect. So that's the first thing that you kind of want to think about when you just take a medication. Particularly with the case of hydroxychloroquine, it can have some effects within the heart and cause arrhythmias, and there is no seen clinical benefit with hydroxychloroquine, and then when you add that risk of an arrhythmia and other issues, it's not something that any of us would recommend that you would try. Actually, hydroxychloroquine has been studied in other viruses as well, and unfortunately, it's never been proven beneficial in any of them.
Yeah, so even when it's been used with malaria, it's better to prevent the malaria than try to treat it with that medication.
Well, malaria is going to be different. I'm talking other viruses such as like dengue and other things like that, where there's proven benefit in malaria. Absolutely, I would, in that case, if you need it, use it. It's more the other types of COVID-19 and other viruses, just throwing that at it, there's no evidence for it.
Melody has a question.
Yes, I have one of my students that wanted to ask, did you guys go directly from high school into a pre-pharmacy program? So I know you said it was 2 years of, was it 2 years of pre-pharmacy and then 4 years of the pharmacy training? Did you go right out of high school into the pre-pharmacy, or did you get a BS degree prior to going into pharmacy school?
So I think we have a mix here. So I went directly into a pre-pharmacy. I knew I wanted to go into pharmacy or at least health. I got to do an internship thing through high school and got to experience it. So I had a good idea going in, but I was always open to changing it up.
And for me, I was kind of the same way. I knew I wanted to do pharmacy, but I did end up getting a bachelor's degree before going in, but that's not required. There are some pharmacy schools that do accept high school students students right after graduation into a pharmacy program. So right out of high school, you're on a 6-year path being a pharmacist.
I did not, I loved working in the pharmacy I worked at, but I was not ready to say, hey, this is what I want to do for the rest of my life. So I actually got an undergrad degree prior to starting pharmacy school. There are a few schools out there. Now, I did not have to have that degree prior to starting pharmacy school, but there are a handful of schools out there that do require a 4-year bachelor's degree prior to going to pharmacy school. So when you're looking around, that's something to consider.
And one other thing with that, some states do have different requirements, so it could be state-related that they have to do a 4-year program.
Thank you. Thank you, guys. Appreciate it.
You're welcome. Okay. All right. So there's one on here that I saw that I personally related to from Alondra. Do you think becoming a pharmacist is a good idea for someone who doesn't like to deal with blood? And that is me. That's something I was thinking about when I was looking at healthcare careers. And so far, so good. I haven't had much blood to deal with. It does depend on what area you're in. So if you're like an ED pharmacist, you'll see a lot more blood than if you're just like if you're on the floor or something like that.
The pharmacists in the EDs are responding to traumas. They're going to see a lot of that. I personally, when I'm at bedside, I have patients growing up and being sick and dealing with all of that. So it's just really considering your practice setting and what you like and don't like.
Good. May I ask one other question? One of my students wanted to know if COVID affected shipments of certain meds or were there shortages because of COVID?
Yes. So basically what we essentially saw happen was all of a sudden everyone needed the same specific medication. And so we have a really amazing pharmacy buyer here, and she was phenomenal, and we have a team of people that work on that, and they really keep their eye on what's available, what's going to be going on shortage, and then if something is going on shortage, what's the next best option, and making sure we start stockpiling and trying to get that as well. So we've actually come through it very well here at Wesley, but yes, absolutely, it becomes an issue when everybody's needing the same medication.
We kind of touched on different teams or different specialty areas. So what some of the questions are there different types or levels of pharmacy, and that's definitely an option. We talked about the community pharmacists. There's also pharmacists that just work research, and I think that was one of the questions. So if you're very interested in the research setting, you can go work for the FDA or the CDC, or there's various different types of associations. I actually, coming out of school, almost did a fellowship just researching HIV medications. So there's definitely those opportunities for clinical specialties. If you want to specialize within a hospital after your 4 years of pharmacy school, you can do what's called a residency, and it's at least 1 year of extensive training. So mine was in pediatrics, so I only deal with the children that get sick in the hospital or out in the clinic. Miles is doing a general one. You can talk about that a little bit.
So currently I'm in a management rotation. So that's part of the reason I'm here. It's part of the management team. But during my residency, I'll rotate to different areas of practice in the pharmacy. So I'll do a different place each month. And as part of the residency, I also have a research component. So I got to pick a research project and develop it and conduct the research and possibly publish as well.
And I think that leads into a lot of what type of a personality we would recommend for someone who's going to be a pharmacist. Really, any type of personality would be good. It depends on the practice setting. Someone at bedside who is very empathetic telling them exactly what these medications are they're getting, what the side effects to those medications are, what the risks and the benefits are. Someone who is loves statistics and loves data, very knowledgeable, research may be the way you want to go. Some people maybe honestly aren't necessarily people persons, and that's okay. You could even consider something like veterinary medicine and veterinary pharmacy. There's literally an avenue for essentially anyone. The only thing that I would say is absolutely required is that you care, you want to make a difference, that you're hardworking, and that you're going to do everything you can to do right by your patient.
And just to piggyback off of Heather, for people who aren't necessarily people, I guess, there is so like with management, it's more of managing the system and less of the people. So a lot of what I've been able to get involved with is how the pharmacy itself runs. So that's been something really interesting to me, as less of a people person than some. Okay, does anyone have any other questions? Or what questions do you have? Oh, hold on, you're muted. Okay, you're good.
I bet my students wish I had a mute button like that. I bet they'd appreciate that. They just said, yeah. I can't remember the name of the medication, and I think you'd mentioned it earlier. And my students that have shadowed there in the past had mentioned it. I just didn't understand exactly what was going on. But it sounded like those little Zorby balls. They're like little rubbery gel-like medicine that got filled in. Does that ring a bell at all?
Does Quadrasphere or Spear?
Yes.
Yeah. So that is actually a delivery device, technically. So for that, it's chemotherapy that you mix with those balls, and they take up the medication, and then they're able to inject that more into a localized area to help reduce side effects, and you're treating the tumor or what have you directly, rather than sending chemo throughout the body. So it's actually really, really cool. They take a long time to make, but they're awesome.
So,
did you have anything to add?
so you would kind of I don't know, surgically implant that at the place? Like, I mean, I'm just going to use an arbitrary example here, but like if you had a thyroid tumor or something like that, you would actually put it in that location. It would disperse the medication directly, basically.
Yeah.
It's typically injected into the area that it's needed, so into that location that the tumor is in, and allowed to do its job, if that makes sense.
It more like leaches into the one area than using your blood to go throughout and then
The entire body.
Yeah.
Gotcha. So that way you have more of a localized effect versus like a full systemic, whole array of symptoms and what have you.
Yeah.
Good questions.
Oh.
They're kind of multitasking here, so give me just a few minutes. I'll see if I can drum up some questions, and I'll be right back.
Okay, Melody, do you have any questions?
No, I think, I think you have touched on everything my students were interested in. And I think you did a great job of presenting the information about pharmacy. We're just sorry we can't actually be there in person like we used to be. So, we will be glad when virtual is not the only option, but we really
We will
appreciate
too.
everything. Yeah, we really appreciate everything that you've covered this morning, and yeah, my students are really interested. They've been taking notes on everything you've been saying, so they're not exactly multitasking like the above classroom. I'm not sure what's going on in the classroom. Anyway, no, we really appreciate everything.
Well, and I will say, I always tell students, residents, everyone this, I had mentors that helped me all the way through, and, were available for any questions that I had at any time, at any stage. So if any students ever have questions, feel free. I don't know if you guys have our email addresses, but I'm Heather. You're always welcome to email me and we can get you that information. Whatever we can do to help, just because by helping others, in the long run, I make sure that I help other future practitioners become as good as they can, which improves care for the patient as well. So.
Absolutely.
Okay. Yeah,
Absolutely.
they're saying that you guys can get Scott and Hope, and they can forward us questions if you have anything.
That sounds great. Thank you.
Okay, and Rob, did you have any other questions come up?
No, I think that's pretty good. We were able to answer all of our stuff, and I like this. I'm gonna show this recording to my other classes. How do I access that?
Okay. Scott will send out the link to you guys.
Gotcha.
Yeah, Scott, I'm going to need that link also, because I need to show it to my other class. Yeah, if you can email me the link, it'll be great.
All right.
We'll be glad to send that link out, and in return, I would hope that you would work on those evaluation forms and bring those back to us so that we can look at them. We take every one of them seriously, and we also share, and we'll share with these three pharmacists as well as Jamie, who is the manager of the pharmacy here. I'm not sure if you guys were aware, but we are actually in the working pharmacy just on the other side here. We have folks doing very important work, so it's been a real treat to be down here and spend some time with the pharmacy folks. And these are really great people, and they'll be glad to answer any questions. So just send those questions to Scott or me, maybe at the time you return the evals, and then we can hop on that and get your questions answered. Thank you so much. We're so glad to have you guys participate, and we look forward to next month. See what we'll do then.
Thank you, guys. Appreciate it.
Thank you.
Bye.
Bye. Okay. Okay, so let's talk about what